It's the light at the end of the COVID-19 tunnel. 2 vaccines that are more than 90% effective.
We can get out of this COVID nightmare.
Tonight, how many doses will Oregon get? Who will get them? When will we get them? And why half of Americans surveyed say they won't even take it. And marijuana won the battle in the House of Representatives today.
This is an important milestone.
But there's a good chance it still might lose the war on drugs. Yesterday, I talked to an economist who predicts a supercharged economy next year.
And I've been fairly optimistic.
But some of you at home, let's just say, don't share his optimism. Here's the story.
All right. Friday today, right? I'm correct in that? I think one of my favorite parts of hosting this show is finding answers to all of your questions, and we get so many of them. Sometimes your feedback is like a launching pad for an entire segment, and you're going to see some examples, a few of them tonight, on how we took your feedback and your questions and we built segments around them. Hi, everybody. I'm Dan Haggerty. This is The Story, and if you want to leave some of your feedback that we could build something around, it's super easy. All the ways to talk to us are right down here at the bottom of your screen. So grab your phone, tweet us, use that hashtag HeyDan, or email thestory@kgw.com. Now, speaking of stories, I think all of us know the story of the boy who cried wolf. I mean, it's one we hear growing up. I just told it to my 4-year-olds recently. It was right over their head. Regardless, it teaches an important lesson, and it's a lesson that we're trying to keep in mind today as we report on the latest batch of COVID-19 numbers that we learned from the Oregon Health Authority. And I think one of the words that's been most overused this year is the word unprecedented. It seems like every day there is something new that happens that is unprecedented. And pretty soon, you know, when we use words like that, like unprecedented, they kind of start to lose their meaning. And when we use it, the media, me here on The Story, some of you at home I know start to roll your eyes. But this is the tricky part. See, everything every day has kind of been unprecedented, right? I mean, a virus isn't supposed to kill dozens of Oregonians every day and infect thousands more people. So keep that in mind while I tell you this next unprecedented update about COVID-19. So today, OHA reported 30 COVID-19 deaths in Oregon. That means Oregon's death toll has crossed a terrible line. Now more than 1,000 people have died. And the number of known cases has jumped by more than 2,100 today, past 80,000 total across the state of Oregon. Now, these numbers have never been this high in a single day, and they're only expected to get higher as we move forward here. And it's possibly the most somber quote of the day that we've ever had here on this show. The governor said today, quote, "Our hardest days still lie ahead." And this is what she means.
What we know is that it's certainly possible that by Christmas, we will be reporting more than double the case rates we are seeing now. And when I think about that, I am just...
Double, okay? Double the cases by Christmas, which is right around the corner. Double the numbers I just told you. I mean, it is a scary thought. But that said, it is vital to keep the good news in mind. And there is good news. For the most part, Oregonians are doing everything, most of us, in their power to stop the spread of this virus. Governor Brown says more than 84% of Oregonians are wearing masks. Travel is down. It's down 35% right now. She even cited cell phone data showing fewer people going into offices. Yet, here we are in unprecedented time during unprecedented times. And we haven't even talked about the vaccine yet, but we will right now in tonight's big story. In less than 2 weeks, the first Oregonians will be getting the COVID vaccine. Did you hear that? Seriously, we are 10 days away right now. Think about being back in March. When did you actually think we would be talking about this? I mean, the timing is you get the point. People do feel hopeful that the U.S. has not 1, but 2 vaccines coming in a matter of days. But it comes with a ton of questions, like this one we got from Kathy recently. She said, since each state has to come up with their own plan for distributing the COVID vaccine, what is Oregon's plan? And it is a great question. And it just so happens it's one of the many questions Kristen Severance set out to answer about these vaccines for us tonight.
The COVID-19 vaccine is the light at the end of a long, dark 10-month tunnel. There are 2 vaccines very close to market. one from Moderna and one from Pfizer. Both have more than a 90% efficacy rate. Both use what's called messenger RNA, where the virus's genetic code is injected into the body so it can instruct cells on what antibodies to produce. The Pfizer vaccine is already being sent to states ahead of expected FDA emergency use authorization. The number of vaccines sent depends on population. Oregon is set to receive more than 147,000 first doses of both the Pfizer and Moderna vaccines by December 22nd. Both vaccines require 2 shots. Nearly 120,000 second doses of both vaccines are expected in Oregon by December 29th. All of these vaccines will go to healthcare workers. I talked to Dr. Joe Sullivan, a senior health advisor with the Oregon Health Authority. He helped come up with the state's plan to distribute the COVID-19 vaccines.
People will look to their healthcare workers as trusted advisors that they can turn to afterwards and ask questions as well.
Both vaccines need to be kept cold before they are distributed. The Pfizer vaccine needs something called ultra-cold storage, which means it needs to be kept between -70 to -80 degrees, while the Moderna vaccine has to be kept in a regular freezer.
How is OHA, working to prepare a cold chain?
I would say this is one of our biggest challenges. So when we talk about cold chain, we're really talking about this ultra cold chain for the Pfizer vaccine. There's 2 ways that we can do it. One is that we have some ultra cold freezers in Oregon that already exist. And the Moderna vaccine has more flexibility. It can be stored in a refrigerator for 30 days and allows for a lot more flexibility.
After healthcare workers, first responders, people in long-term care facilities, and their caregivers get vaccinated, then it's essential workers, then everyone else.
People who are essential workers, who keep our society going, our teachers, our transportation workers, our food handlers, and then we're looking at people with chronic diseases, and people over 65. To get to the end of that, we're probably looking at March, at the end of March.
That's if people go for it. 39% of U.S. adults surveyed by the Pew Research Center in November said they would definitely or probably not take a COVID-19 vaccine, citing concerns over safety. The anti-vaxxer group Oregonians for Medical Freedom are already posting banners like this one on I-5 saying COVID-19 vaccine manufacturers are exempt from liability. Dr. Sullivan says while these vaccines came to market fast, they're safe. The vaccines must go through all the independent safety steps a normal vaccine would go through to get that emergency use authorization by the FDA. While a normal vaccine study may have 5,000 people, these trials have between 30 to 60,000 people. He said there have been no serious adverse events like heart attacks or paralysis, just normal side effects you could expect with most vaccines.
With these vaccines, you will get normal side effects from a vaccine, like your arm might be sore, or you may have a low-grade fever or a headache, or be tired the next day. And that's the sign that the vaccine is working and your immune system is responding. But the value is that we can get out of this COVID nightmare.
Okay, Kristen Severance joining us now. Let's talk a little bit more about these side effects. Doctors do want us to be discussing these, right?
They do. So you heard the doctor mention you could have some soreness in your arm, or you could develop flu-like symptoms. That's symptoms. You're not going to be getting the flu from the vaccine, or you're not going to get COVID-19 from getting the vaccine. But they want people to know what to expect. The American Medical Association told the CDC, we need to tell people what to expect because remember, 2 doses. You have to get 2 shots. And they don't want people to get the first vaccine shot, feel sick, and then not go back for that second shot because you need both shots in order for this to work.
Got it. Kristen, thank you.
You're welcome.
Now, I want to show you a tool in the New York Times we think is worth your time. They worked with experts to calculate your place in line for the vaccine based on some pretty basic facts about yourself, like your age and what county you live in, what type of job you have, and whether you have COVID-related health risks. So, of course, I had to try this out. I plugged my info in. No, I'm not going to tell you my age. And as for my job, I did mark essential worker. Feel free to disagree with me on that. That's just what I picked. And this is where I fall based on that criteria. Across the U.S., there are more than 126 million people in front of me. in line, or about a third of the country. In Oregon, my odds really aren't that much better. I'm behind 1.6 million people. And in Clackamas County, where I live now, I'm behind more than 152,000 people. So I may have to be waiting for a little while. The question is why? Why would I have to wait? Well, because the vaccine will be handed first to people who are most at risk and most likely to spread it. So people 18 to 30, they may not be in serious risk of getting a very serious case of COVID, but they are more likely to accidentally spread the virus if they're asymptomatic and going about their day. It's a really interesting tool. It's from the New York Times. I recommend that you get on there and check it out, plug in your info, and see where you end up. I think you might be surprised. But while we're all waiting to wait in line, scientists say the virus is going to keep surging. It's actually spreading so fast that contact tracers, they just can't keep up with things anymore. You remember how important we told you these contact tracers were? Those were the people who were trying to call everyone and keep in contact with them if they knew they had contact with somebody who tested positive for the virus. Now, that might have been feasible, of course, when Oregon had, I don't know, a few dozen cases a day, but not thousands. Now, in some states, including Washington, there's quite literally an app for that, and millions of people are using it. But Oregon isn't, because we don't have one yet. And Maggie Vespa found out we probably won't have one for at least a month.
Months behind those in other states and 1 month behind Washington's, which debuted this week, Oregon's contact tracing app is set to launch in January 2021. Hopefully. No one from the Oregon Health Authority was free to go on camera Friday to explain what's taking so long.
This is really part of a multifaceted approach.
In early October, Dr. Timothy Menza gave more details to KGW's Galen Etlin.
How far is Oregon away from this technology becoming a reality?
So we still have 2 months to do a little bit of work to make sure it's right, it's working the way we want it to work.
Now, here we are, 2 months later, and state officials say while Oregon's app worked well in early testing, they're still waiting on data from a pilot program at Oregon State University, one that's not going according to plan. It began early last month, and while about 9,000 people have enrolled, OSU staff say none of them have uploaded positive test results. Officials point out most students are attending class remotely, meaning they may be notifying friends and family privately. Still, in the end, this means the notification system has yet to be tested. That said, no official end date has been set for this pilot program.
This technology has been utilized in more than 24 to 30 states nationwide. Oregon not being the first isn't the problem at all. We want to get it right. But again, it's just one step in the process of addressing the virus.
Again, they hope to launch the app statewide next month. If that happens, you would be given the option to opt in. Then officials say the app doesn't track a user's locations. Instead, it records any time an app user gets physically close to another app user. If and when a user uploads a positive test result, the app will send an alert to those they've been around, letting them know they've been exposed. The infected person's identity, officials say, remains anonymous. This as COVID cases, hospitalizations, and deaths surge at historic rates, leaving contact tracers once tasked with tracking infections and their sources overwhelmed. Next month, those in Oregon will get some help, or at least that's the plan. And a question, by the way, that we got from a lot of our viewers was, should Oregonians sign up for Washington's app, especially if they travel into Clark County? And Washington officials say yes. They want you to. I mean, the only thing that they wanted people to know is that Oregonians can't upload their own positive test results to that app. They can just get alerts if a Washingtonian they were physically close to tests positive. So, Dan, a good note there, but they can sign up.
Okay, but speaking of this app in Washington, it's done. I mean, it's up and running. There's like 1 million people using it right now. Why can't Oregon just take that same platform and use it?
I know, that feels like such a logical step, doesn't it? So I put that question to the Oregon Health Authority, and a spokesperson wrote back and told me that was a good question. And she said she would look into an answer. We haven't gotten the answer yet, but I'll obviously let you know if and when we do.
Maggie, with good questions, I'm sure you'll find an answer, Maggie. Thank you.
If a doctor says this,
None of us once wore a mask in my clinic.
can he lose his license? Today, we found out. And ganja gets a green light in Congress, but it still might hit a wall of red.
The House of Representatives is spending this week on pressing issues like marijuana.
When the story continues.
marijuana.
Welcome back. This is The Story. Thank you so much for everybody writing in and commenting. And I hope you know, and I hope we kind of prove it to you in our coverage here, that your feedback and your questions help us decide what we do on this show every night. We have these editorial meetings in the morning, and we're going through your questions and saying, you know, which ones do you think are the most important? You know, because we have really smart viewers who know what they're talking about. So grab your phone, be one of those smart viewers, and keep those messages coming. And you can see all the ways again at the bottom of the screen. Use that hashtag HeyDan on Twitter or email thestory@kgw.com. Now, I'm sure a lot of folks who watch us regularly do remember this guy. This is Dr. Stephen LaTulip, a family doctor in Dallas, Oregon, who came under fire after this video here of him speaking at a pro-Trump Stop the Steal rally was unearthed by our Kyle Aboshi. Listen to what Dr. LaTulip said about wearing masks.
I and my staff, none of us once wore a mask in my clinic.
So, considering that goes against the advice of the CDC and the OHA and basically every other doctor on earth, it's natural that we got this next question from a viewer named Tracy Turner. She said, "Hey Dan, could that particular doctor lose his license to practice medicine? I mean, he's actually hurting, not helping people." Well, Tracy, I'm really glad you asked that question because as of today, we know the answer. Here's Kyle Aboshi with an update on Dr. LaTulip's career.
Thank you for calling Southview Medical Arts, the office of Dr. Stephen LaTulip. If you have reached this recording, the office is now closed.
Nobody's answering the phone, and the doctor's office is closed after the state medical board suspended the license of an Oregon doctor who refused to wear a mask while treating patients, despite government orders to help limit the spread of COVID-19.
My name is Steve LaTulip. I am a practicing physician in Dallas, Oregon right now.
Earlier this week, a KGW investigation highlighted controversial comments made by Dr. Stephen LaTulip during a pro-Trump rally in Salem on November 9th, then posted on YouTube by the Multnomah County Republican Party.
I hate to tell you this, it might scare you, but I and my staff, none of us once wore a mask in my clinic.
In the video, Dr. LaTulip admitted breaking COVID rules despite the governor's executive order, which says healthcare personnel are required to wear a face mask or face covering while in a healthcare office, with limited exceptions. On Thursday, the Oregon Medical Board voted to suspend LaTulip's medical license due to the board's concern for the safety and welfare of licensees' current and future patients. LaTulip owns and operates Southview Medical Arts in Dallas, just outside of Salem.
I petition all of you, please take off the mask of shame.
LaTulip's comments run counter to state, federal, and private medical experts who urge healthcare professionals to always wear face masks while inside healthcare facilities. LaTulip could not be reached for comment, but in a phone interview with NBC News earlier this week, the doctor doubled down on his anti-mask stance, saying he doesn't agree with requiring masks because he believes, quote, there's bad science behind it. The indefinite suspension prevents LaTulip from practicing medicine anywhere in the state. Kyle Aboshi, KGW News.
Well, for those of us actually doing our part to try and slow the spread of this virus, the vaccine news has kind of been what a lot of people at least have been waiting for and feeling more optimistic maybe right now than we have been in quite some time. And yesterday we talked to an Oregon economist who wrote this opinion piece in Bloomberg saying that he is extremely optimistic about the economy next year. Tim Dewey had 3 reasons for this optimism. Americans have actually been saving a lot of money this year. Wages have recovered, and if the vaccine rolls out without any problems, he expects there to be kind of explosive spending to happen in the service industry. A few minutes after we aired my conversation with him, we ran another story that painted a very different picture of reality.
We're back outside Woodlawn Elementary School in Northeast Portland as Mary Evans, Tiana Sly, and volunteers set up the Woodlawn Food Pantry. They've been here giving out bags of food to anyone who needs it every week, rain or shine. Even COVID couldn't stop them.
When you see the line of cars start, we are ready to greet our families and put food in our car.
So other than feeling good about seeing people helping people, it's not a very optimistic outlook when you see people in need like that. And a viewer named Karen Freeman noticed this, and she wrote us. She said, interesting juxtaposition of The Economist, who predicts that people will massively spend their savings next year, and the Woodlawn families receiving food who say that they're down to nothing. It sadly highlights the difference between people's realities, and you really make a great point there. Tim Dewey, the economist that said that I spoke to, addressed that as well. And here's how he phrased it when I brought up that very point when questioning him.
And that is always one of the hardest things to comprehend. You know, the next 2 or 3 months are expected to be fairly challenging as these coronavirus cases have gotten higher and have stayed higher. You know, I try to look on the other side of that. A lot of what I do is a large part of it ends up being for financial market participants. And so, you know, I'm trying to figure out, well, how is this going to evolve over the next 2 or 3 months or beyond that? I do think, you know, as behavior changes and restrictions kick in, we will eventually get to the peak of this surge like we have in the past, and we'll be on the downside of the surge. And then as we get to the downside of the surge, we'll have the vaccines look like they're going to be rolling out. And so you get to the middle of next year and you are possibly in a very good place for a rapid normalization of activity. I think that some of the kinds of activity, service sector activity, there's going to be a lot of demand for you know, vacations, restaurants, leisure and hospitality events that's going to come on, I think, fairly quickly once people feel that those activities are again safe.
And you should check out Dewey's his column in Bloomberg, and he points out that he's looking at things from a macro perspective, so like the entire country as a whole, of course. And we've been telling you the stories of the way too many people experiencing financial ruin because of this virus, and that's just as true. But according to Dewey, as a whole, the United States economy could come roaring back sooner than we might have expected. Dewey also talked about how this recovery that we will hopefully go through, as he described, will be different than what we experienced in the 2008 housing crisis recovery. I know a lot of people have been kind of comparing those two. We have the full conversation with him right now at the KGW YouTube channel. The House of Representatives just did something that no other chamber of Congress has, and it has to do with one of the Northwest's favorite vices. That's right, it's time for Vice News. By a vote of 228 to 164, the House voted to decriminalize cannabis nationally. 6 Democrats voted no on this, but 5 Republicans voted yes. The bill they voted on is called the MORE Act, which stands for Marijuana Opportunity Reinvestment and Expungement, because if there's one thing Congress loves more than anything else, it's an unnecessary acronym. The MORE Act calls for 2 key changes. 1, it would decriminalize cannabis in every corner of the United States. And 2, it would create a path to erase nonviolent federal marijuana offenses. And that's the key point Oregon Congressman Earl Blumenauer made today when he talked about the bill's passage. He says this bill is a step forward toward treating drug addiction instead of punishing it.
We used to criminalize somebody who was a late-stage chronic alcoholic. We put him in jail. Well, now we're not doing that so much. We're dealing with treatment. And I do think that what's going to happen over the next 10 years, not that we're going to legalize all those drugs, but we're not going to criminalize an addict. They are sick. We want them to have help. And it's more humane to do that in terms of treatment rather than putting people in jail. This legislation doesn't usher that era in, but I think that's where America is going. We don't want to lock up sick people. We want to treat them. And that's a much more effective effort.
Blumenauer is one of the loudest cannabis advocates in the House, and last night when he was presiding over the floor debate of the MORE Act, he even whipped out a very appropriate face mask. I believe those are marijuana leaves on there. Now, here's the rub. The bill still needs to pass the Senate, okay? And there was some bipartisan support, of course, for this bill in the House, but chances are the Republican-controlled Senate won't even take it up. And if you're wondering why we expect that, let's listen to Senate Majority Leader Mitch McConnell talk about the bill today.
The House of Representatives is spending this week on pressing issues like marijuana.
Now, there's a chance Democrats could take the Senate after a pair of Senate runoff elections in Georgia. Then the MORE Act might actually have a chance. But if Republicans hold the Senate, the bill could get put. Only enough time for one comment tonight. We highlighted a question from Tracy Turner earlier asking about the doctor and whether or not that person could have their license revoked. And I said that she asked a really good question, to which Tracy responded, "Hey, Dan, not that I'm not used to the mistake because of my name, but I am not a female." I'm sorry, man. That's my bad. It's Friday. It was a great question. Keep them coming. Thank you so much to Tracy and all of yours. That's the story for tonight. See you next time.